The information presented in this video is for educational purposes only and should not be considered as medical advice. Always consult with a qualified healthcare professional before making any changes to your diet, exercise, routine, or health practices. The content is based on personal experiences and research, but it may not be suitable for everyone. Neither the presenter, myself, nor this channel is responsible for any adverse effects or outcomes resulting from the use of the information provided. Please do your own research and consult a professional for any specific health concerns. Did you know that there are two main types of vagus nerve dysfunction? Hypervagotonia and hypovagotonia. In other words, hyperactive vagus nerve or underactive vagus nerve, both of which can be caused by vagus nerve damage or compression. Compression syndromes are in reference to compression in the hiatal hernia type cases or more commonly in the cervical region. These cases actually are not that uncommon. In fact, they're the majority of my clinical practice. So let's talk about the first one. This is the C2 and below instability type. This is where those joints, when they're moving through range of motion, they slide or they twist in a way that's not normal, and they move off their normal axis of rotation. And then what happens is that the muscles around the neck, particularly the sternocleidomastoid and the scalene muscles, contract and kind of strangle the vagus nerve in the carotid sheath. That's the most common. Other types that you'll see are quite rare. They are atlantoaxial and craniocervical instability, although those can be termed the same thing, where the C1 moves excessively on the C2, particularly in flexion, but it also can be in any range of motion, and it compresses the upper part of the spinal cord and the lower portion of the brainstem known as the medulla oblongata. And this can result in a broad range of nerves being affected, not just the vagus nerve, and often is accompanied by things like dizziness, problems with tongue movement, and muscle issues in the trapezius and scalenes, not scalenes, it's sternocleidomastoid. And you'll find those are in some ways hyperactive or underactive depending on the situation. They're often associated with things like ehlers-danlos syndrome and hypermobility syndromes, and can also be associated with, as can the mid-cervical instability, whiplash injuries and motor vehicle accidents and things like that. Another type is called Chiari malformation, and this is also associated with hypermobility syndromes, but it is a congenital deformity. In other words, you're born with it, right? Where the brain, parts of the brain known as the cerebellum, some of the brainstem, starts creeping down into the spinal canal, and it shouldn't be there. And it's called Chiari malformation, and you need surgery to rectify it. Now, that tends to be best examined under MRI in a standing position. Otherwise, you may miss it when you're lying down. Cervical instability as a cause is generally noted by a bunch of different orthopedic tests that your clinician, your physio, PT, musculoskeletal therapist might be able to do and see whether instability is a factor. It's also seen on dynamic X-ray. Upper cervical instability is also able to be examined clinically through a range of tests as well, not just our dynamic cervical X-ray. But these are all underlying reasons as far as a cervical mechanical cause of vagus nerve dysfunction and compression.